Hi, my name is Dave Irish, and we're going to spend a little time talking about the options that are available for health insurance in 2018. And it's kind of interesting when we get into this discussion because, I used to sit down with customers and we'd plan the future, right? We'd plan forever. And we don't do that anymore. You know what we're going to plan? We're going to plan 2018. So let's talk about the products that are available and where you might fit, okay? First, we all know about Obamacare Exchange. In Maricopa County, there's one carrier, it's AM Better. The truth is they do a good job. The networks are pretty robust. And the premium, right, that's the money you pay every month, is predicated on what you earn. So, if you are making something less than $50,000 or $60,000 a year, specifically line 37 of your tax return, and you have a family with 3 or 4 kids, you could be making as much as $80,000 or $90,000 a year. And what happens is that product, the price for that product may be $2,000 a month. But you qualify for subsidy money, and we all have learned how that works now. So basically you get a buy down, and the premium that you pay for that product will normally be about 8.5% of your adjusted gross income. So if you're making about 50 grand, you're going to be paying about 4 grand, $4,200 a year for insurance product. We don't need to spend a lot of time researching insurance companies and doing all that because it doesn't matter. There's one plan and one plan only that takes subsidy money. If you are sick, you've got pre-existing conditions, you've got income qualifiers that put you into that bucket, then we want to help you to enroll with healthcare.gov. Let's talk about why we can help. You could certainly call the 800 number and go through a 45-minute something that'll totally frustrate you. Or you can give us a call and we'll enroll you in a matter of minutes. And the advantage to that is if you have significant claim problems or you've got something going on, you can shoot us an email and we're tapped into the insurance company. Healthcare.gov will not help you do that. Now, word of caution. We do not want to miss on the income, right? So if you tell me you make 50 grand and we're projecting ahead 2018 and you end up making 70 grand, do not be surprised if there's a healthy tax bill waiting for you. So you must zero in on that income, okay? Now, if you are making money, you're making 100,000, you're making 70,000, you're 40 years old and single and you're making 60 or 70K, you can still buy that product without a subsidy, but you're going to be shocked at the price of that product, okay? So we're going to talk about some other options now for people who do not qualify for subsidy money, okay? Specifically, if you own a business and you have a federal tax ID number and you have an employee that is W-2'd in that business, it may make a lot of sense for us to put together a small group plan. The advantage of that is that your business will pay the premium, so it's pre-tax money. You will have a vehicle put in place for your company, so as employees come in, you can add them to your program with a 60 or 90-day probationary period. And the advantage of that process is you end up with a much larger network, a PPO network, and a broader spectrum of product design, okay? The third entity that may be interesting, or option, is something called a ministry program. And you probably have heard advertisements on Fox News or maybe even on the radio that talks about Medi-Share and Alera Healthcare. These are ministry programs that technically are exempt from you having to pay a fine. Here's the catch. They do a good job, first of all. I would feel 100% safe if my family were insured there. There is a 24-month pre-existing condition clause in most of these contracts. So when you buy that product, it may be 50 to 75% lower than even a group plan. But if you've got a bum knee or a bad back or you've got something you know you're going to need a surgery for, they will never pay that claim. So most of those programs, you have the ability to go to the doctor for a $20 or $30 copay. But if you end up in the hospital for something that was in your body 2 years prior to you being approved for that program, that claim will get denied. So it's an awesome opportunity for somebody who is in good health and is not currently managing any kind of an illness. Now that doesn't mean that if you have, for example, if you have an underactive thyroid or if you're doing a little asthma medication, something that you think you can manage, I'm comfortable with those programs, okay? The final option is something called short-term major medical. You may have been on a plan like that in the past. Those plans were designed to basically bridge a gap between your COBRA product and you getting a new job. Some companies are getting very innovative with short-term major medical. So there's a company in the market today. If you are in great health, what they'll do is they'll put you on a plan, provide you some doctor coverage and some lab test coverage and things like that. And they have a short-term major medical policy waiting in the wings if you need it. The reason that's important is because the law says with short-term major medical, we can only write it for 90 days at a time. That's dangerous. When you buy a plan that ends in 90 days, you might as well stand on the corner of a bridge and get ready to jump. Because if you end up in the hospital on September 30th and your plan ends and you're still in the hospital on October 1st, guess who's paying that bill? So what I've found to be the case is most people fall into one of those 4 categories. And I, as a broker, represent each of those companies and the people that we work with in our office. And so what we want to do is we want to make sure you end up in exactly the right space to save money, have good coverage, and if you have a pre-existing condition, we want to know that that's going to get covered, okay? I hope this helps. Shoot me back an email, and we'll talk about your options. Thanks.